Hi everyone, thank you very much for coming and for the invitation. This is the second debate today. We had one this afternoon with different speakers and it's on again tonight. So this is a very topical and interesting topic which I hope you'll enjoy. So I'm talking about electronic cigarettes and in favour of them, vaporisers as we mainly call them, and Alex Wodak will be discussing that a little bit further. I have no financial conflicts with any vaporizer company or tobacco company. I'm going to discuss, do these products work in helping smokers to quit, and then looking at their safety. So basically those two issues, and Alex will discuss some other issues like harm reduction and some of the barriers, the other concerns about these products. First of all, I just wanted to cover several of the main independent reviews on these products. There's a lot of information out there, different views and interpretations on different studies. But for example, the Royal College of Physicians did a full independent review and concluded that e-cigarettes appear to be effective when used by smokers as an aid to quitting smoking. Public Health England concluded that recent studies support the Cochrane Review findings that electronic cigarettes can help people quit smoking and reduce consumption. And this rather long report is by the United Kingdom Centre for Tobacco and Alcohol Studies, and they basically said, look, when you look at all the different types of evidence, the control studies, observational studies, what we know about nicotine replacement, the anecdotes, observational studies, we have confidence that these products are effective. So that's their overviews of the evidence, which may be more helpful than some of the individual stuff. Then there's the question of randomised trials. There have been two that met the Cochrane standards, and they concluded that they were at least as effective as nicotine replacement therapy. But there were only two, and the conclusion was that the evidence was low to very low based on that small number. What they also said was that these were, the ones that were used in these trials were quite some years ago. They were now obsolete models that were cigar-likes, which produced very small amounts of nicotine, and many had technical flaws. And what we now know is that more advanced devices are much more effective. So tank models and the more advanced models that we see now work much better. They deliver more nicotine and are more effective. And I wanted to make the point that people say, well, why don't we have more randomised controlled trials? Well, there's quite a lot of information, there's quite a lot of issues around this. And one is that these are complex public health interventions that don't lend themselves well to randomised controlled trials. So randomised controlled trials are good where you have a drug, you're comparing it to placebo, and you have a binary choice and an outcome compared to placebo. With these products, it's a very different process. So people don't just pick a machine off the shelf. They go through a process of trying different devices, different flavours, different strengths. They do it over time. And it's not a binary process. It's a process that takes time. They get advice from different people. They get onto online forums. It's a much more complex process. And there are many experts who say that's not the best approach in assessing these products. But I think the best evidence is the population studies. So in the European Union, for example, one very large study found that in 2014, 6 million people, when they extrapolated the numbers, they surveyed 27,000 people, self-reported having quit using an electronic cigarette, personal vaporizer. So that's, when they extrapolated, this was a representative sample, 6 million people they felt had quit, and many had cut down. In the UK, there are, according to the Office of National Statistics, there are 1.5 million vapers who are former smokers, and there are about 650,000 former smokers who are former vapers. So the evidence is, in the US as well, that many people actually are quitting. And we're seeing that in the population smoking rates. So here's the figures in the US, and they're running from 1975 to 2017. The latest figures were just released. But what they show is that for a period there, the smoking rate in the US was quite flat. At around 2010, e-cigarettes started to becoming more widely available. And you can see from that point, there's been a very rapid fall. Now, we can't say, yes, that was all e-cigarettes. But if you're arguing that e-cigarettes are undermining tobacco control, then that isn't consistent with that. That suggests that they're likely to be playing a part, and that's been generally the conclusion. This very interesting study came out recently too. This was based on a national study in the US, a population study. And what it's showing is that, I haven't got a pointer, but what it's showing is that from 2001 through to 2010, the annual rate of quitting in the US was about 4%, just over 4%. In 2010, the numbers of e-cigarette users started to rise. And in 2014, for the first time in about 35 years, the quitting rate increased. And when they broke that down, people who were not using e-cigarettes had similar quit rates to those in previous years, but people who used e-cigarettes had much higher quit rates. This is a national population study which suggests that e-cigarettes are helping to make people are making more quit attempts, and they're more successful when they do quit. And their conclusion was that vaporisers appear to have helped to increase smoking cessation at the population level. So these are more population studies. And just briefly, I won't bore you, but there's a number of observational studies which are fairly compelling. The ones that are most effective are the ones that ask, are people using these products to quit? And if they are they using them daily? Because it's only regular use that really counts. People who use them once or twice, they don't really count as a quitting aid. So Bina found, for example, people who use them daily for over a month had 6 times the chance of quitting. Giovenco, daily users were 3 times more likely. And then there's the question of longer term use. So if you use them for a couple of years, the people who are using them long term are much more likely to quit. And that comes up a number of times. So it's very much about using them regularly, frequently. And I won't go into all the details, but one of the studies by Hayek found that if we add other pharmacotherapies to electronic cigarettes, you get the best of all quit rates. So they found adding varenicline gave very high success rates added to electronic cigarettes, personal vaporisers, and the same with, say, a nicotine patch, and the provision of counselling. And in the final study, 61% of users after 12 months were still abstinent from smoking. So, which is pretty good, whereas amongst the smokers, about 20% of them had quit. So there's very good evidence for e-cigarettes being good for relapse prevention. So that's some studies of effectiveness. I'm happy to take any questions, if there are any. Yes? Yeah, I'll repeat it.
Question.
Yeah.
Are there any differentiations in those studies between nicotine-containing fluids and the variety of other options?
Yeah. So most of the people use nicotine in their products. It varies from one country to another. In the UK, it's about 85%, I think. Youth, mostly about 1 in 4 use nicotine. It's not something that was actually studied in most of those studies. So we know that personal vaporisers without nicotine are effective. They're more effective than, at least twice as effective as vaporisers with nicotine. So nicotine certainly helps. But it's the hand to mouth and the whole vaping experience that is often all that some people need.
Do we know in Australia how many vapor users are using nicotine fluid?
Yeah, the last national survey it was about 40%, 43% reported using. Oh, sorry, but 43% of Australian vapers used nicotine in the last national survey. Yeah, sorry, I have to go back here. I went a little bit far. Any other questions while doing this?
Any other cardiovascular risk markers have been changed significantly since the
Yeah, look, there have been reviews of the cardiovascular effects of vaping. Nicotine is the main, according to the reviews, nicotine is the main cardiovascular active agent, and so the effects of those of nicotine. So it can put the blood pressure up and the pulse. It can increase the risk of arrhythmia. It may have effect on lipids. But the conclusion from the reviews is that it's much safer from a cardiovascular point of view to use personal vaporizer than a cigarette. So yes, there are risks, but they're generally regarded as very small.
Colin, will you come to some comparative rates for Australia and quitting trajectories to compare with the American?
Quitting trajectories. Yes, so the problem with Australia is that, and I didn't put that many slides up because I didn't have that much time, but the problem with this for Australia is that over the last 3 years, smoking rates have not fallen. So if you look at the National Drug Strategy Household Surveys, which are our main surveys for drug and smoking prevalence, from 2013 to 2016, there was no significant drop in smoking rates. And you can see the difference with the US and the UK. Rates are falling faster than ever in the presence of electronic cigarettes. And the question is, of course, can e-cigarettes accelerate that rate? And do we need e-cigarettes now, given that we seem to have hit a bit of a brick wall? And it's argued that current smokers are just struggling to quit. And we can see that all the time. We know most smokers have tried repeatedly to quit and can't. And it's possible that personal vaporisers may, for tobacco harm reduction, be another solution for them. So that's one of the reasons we argue for vaporisers for the Australian context. And I think Alex is going to talk more about that. Yeah.
And another recollection from a previous talk you gave, did you tell us that one of those countries, the US or the UK, has actually overtaken Australia?
Yes, the smoking rate in the US is now 14.8 for adults, 18 and over. In the UK, it's 15.8 and Australia's 15.6. Whereas Australia's always been traditionally well ahead of those other countries, and the decline has been much more rapid in recent years. Yeah. So let's talk about safety. I think it's really important to state that yes, there are potential risks from electronic cigarettes. Yes, people are inhaling nicotine and other chemicals. In general, the other chemicals are in trace amounts, but there are potential risks. They're not risk-free, and we don't recommend them to non-smokers and to young people. But in fact, they're used almost exclusively by ex-smokers and smokers who are trying to quit. So if we're looking at the health risk from vaping, we need to compare it to the risk of smoking, because it's either you smoke or you vape, and it's very rare for there to be much use by non-smokers. And when you're comparing the risk, you need to remember that smoking kills up to 2 in 3 regular long-term users. So that's what we're comparing any risk from smoking, from vaping, to. There's debate about how harmful e-cigarettes are. Public Health England has said that, and the Royal College of Physicians have done independent reviews and concluded that the risk is no more than 5% of that of smoking, and it may be quite a lot less than that. And they base that on the fact that most of the chemicals in smoke are not present in vapour, and those that are there are mostly below 1% of the level in smoke. So common sense would tell you that they've got to be a lot safer. There are small amounts of chemicals in personal vaporisers that aren't in smoke, but they haven't been shown to have any significant health effects. So their assessment of 95% is based on what we know of the toxicology, the chemistry, the physics of vapour compared to smoking. So the College of Physicians concluded long-term risks, and that's down the track, and this is a bold prediction, but based on what we know, and we know a lot more now than we used to know about smoke when it first appeared, but based on the toxicology and all the other studies, they're unlikely to exceed 5% of those associated with smoke products, and may well be substantially lower. So that's the Royal College of Physicians' view. The other thing that supports safety of e-cigarettes is the biomarkers. So these are metabolites of carcinogens and toxins that are found in the body. And people who vape, who used to smoke, have significantly reduced levels of biomarkers. In this study, what it shows is On the y-axis, the level of toxin or metabolite. On the x-axis, we can see different products. So nicotine on the left-hand side, the left-hand bar is nicotine in a smoker. The other two bars stand for NRT and the vaporizer. I haven't got a pointer, unfortunately, but you can see that nicotine levels are pretty close to the same. But as you go across the scale, you can see that the levels of these metabolites in vaping are substantially less than smoking, and roughly, thank you.
Back in time.
Yeah, back in time, yeah. Roughly at the level, so here we are, the two main cancer-causing agents in smoke are 1,3-butadiene and acrylonitrile. They account for about 3/4 of the risk of cancer. And you can see that the amount of 1,3-butadiene is actually less than what they found in people who used to smoke who are on NRT. And the same with acrylonitrile, less than what you find in the NRT, and certainly a lot less than the smokers. And the other products are all mostly carcinogens or toxins. Thank you. Very good. So not only are there fewer products, chemicals in the vapour, but in the body, in the saliva and the urine, when they test for these products of metabolism, they find they're substantially less. There have been a couple of recent studies that have looked at cancer risk in vapours. Stevens did a study recently where he measured lifetime cancer risk from daily vaping. So he looked at all the toxins, the carcinogens in vapour, and their potency, and compared that to smoke. He concluded with modelling that the risk was less than 1% that of smoke, of lifetime cancer risk. Using a different method, these are not tobacco company studies, Scungio found that excess lung cancer risk is 57,000 times lower than smoking. Using a different model, which apparently is valid, based on particulate matter, but obviously way below levels of concern. Maybe the toxicologists will have something to say about that, but the risk with cancer is clearly low. In terms of respiratory effects, there is some research to show that there's an association between e-cigarette use and bronchitic symptoms. We're not sure if that's causal in adolescents. There is some inflammation in the lungs from e-cigarettes. Whether that's clinically significant, we don't know. But there are clinical studies that have found improved COPD, asthma, lung function after switching. So people's health improves. Clinical markers, objective and subjective markers improve. Just this week there was published a new study, and I think this is quite important in that this study in Italy, they found 9 vapers who never smoked. Now in Italy, in Europe, there are about 1 in 1,000 never vapers. They're never smokers who vape. They're very hard to find, 1 in 1,000. They found 9 of them, and they compared them to a control group, and they followed them for 3.5 years. And they monitored them for spirometry, symptoms, inflammatory markers. They did high-resolution CT, and they checked for symptoms. And there was no change in that group compared to the control group. There was no evidence of any subjective or objective change as a result of vaping over 3.5 years. And that's useful because often the problem is disentangling the effects of smoking from the effects of vaping. So these were never smokers, and over 3.5 years there was no change, and including blood pressure and pulse as well.
Did they have a smoking control group?
They had a non-smoking control group.
But did they have a smoking group
No.
to see? No.
No.
Okay.
No, sorry, no smoking control group. They had a non-smoking control group. So they found, compared to the non-smoking control group, no changes. Most experts agree that the risk of harm from vapour exposure to bystanders, as far as we know from the evidence available now, is negligible. And that's, the College of Physicians and Public Health England have made that very clear. Studies have found very low nicotine levels. Most toxin levels in exhaled vapour are below trace levels. Yes, there's particulate matter, but it's a liquid particulate matter. It's not solid like the particulate matter from smoke. There are no side stream emissions, so there's nothing burning off the end of a personal vaporizer, and the half-life is much shorter. So it hangs around in the air much less, 11 seconds half-life, compared to the much longer half-life of smoke. So, which brings me to the final concern is that people are worried about long-term health risks, and that's a valid concern. And there are a lot of unknowns, but there are also a lot of knowns. We know a lot about vapor now. And the best estimate, based on all of what we know and what we think we don't know, is that it's unlikely over the long term to be more than 5% of the risk. That's no different to any new drug. Now, do we wait 30 years for definitive evidence, or do we make a decision based on what we know now? Because what we know now is that 2 out of 3 smokers are going to die prematurely from their smoking. And yes, there are potential risks, and we may find out one day there are problems, but really the chance of that being anything near the risk of smoking is extremely small. So simply, in conclusion, I'd like to say that we know that vaporizers are helping many smokers to quit. They're not for everyone, but for those who can't quit, they're an option. And they're not risk-free, but they appear to be at least 95% less harmful than smoking. Any questions?
Colin, there would be several options: legalising, licensing nicotine products as medicines that people like you and we could prescribe, or just selling them on the market, have various restrictions. Where do you stand on that?
Yeah, well, there are a couple of legal pathways. So under the TGA personal importation scheme, if you have a script from a doctor, you can legally import nicotine solutions for personal use. So that's quite legal. And a compounding pharmacy, if it has an authority, can manufacture nicotine e-liquid, which is legally available with a prescription from a doctor. So there are legal pathways.
That's now, but what would you like to see in the future?
Well, I'd like to see regulation, so I think we need to improve quality and safety standards. I think we need to make these available to smokers as an alternative for those who can't quit. And I think we need to protect the public. So we need to prevent children from accessing these products. We need child-proof bottles. We need restrictions on marketing. We need to minimise any concern to public health. And in terms of nicotine, I think low concentrations of nicotine should be readily available under certain conditions, without a prescription. We're talking about 1 or 2% nicotine. And the risk of harm from that is minimal. It's no more than household bleach or any other household chemical.
How many post-marketing studies are being done on e-cigarettes, phase 4 post-marketing studies?
Post-marketing studies. So these are really all post-marketing studies. These are all, you mean out in the wider community, not formal studies done by like a drug company, but we have these, you mean in terms of risk or in terms of effectiveness?
Safety, effectiveness,
Yeah.
longevity.
Well, in the studies that have been done, there have been no serious adverse events, apart from the occasional explosion, which is very rare. There are no serious medical events.
Explosion is the device exploding.
Yeah, this is the battery exploding. It doesn't happen with normal devices. It's when people have loose batteries in their pockets with coins, and when they use what's called mechanical mods, which is often a homemade device or a modified device which doesn't have electrical protection. So the sort of device that I recommend to my patients are, there's no risk of that. But with a lithium-ion battery, there always is that tiny risk.
Phones explode.
Sorry?
Phones.
Yeah, phones and laptops and cameras explode. And that's certainly known to happen. And there are the London Fire Brigade worked out that the risk of a fire from an e-cigarette is about 255 times less than smoking. So I mean, there are risks, yes, but they're much less than smoking.
Colin, Jay made reference to phase 4 studies.
Mm-hmm.
That suggests that there have been phase 1, 2 and 3 studies beforehand, and it suggests that a pharmaceutical regulatory pathway has been followed, and the substances have either been registered or are about to be registered as therapeutic goods. Have they?
No. So these are not regarded as therapeutic products. So first of all, these are the preferred model. I think these are consumer products. So these are replacing an existing consumer product, a lethal existing consumer product. It's a safer alternative to that. So they're being used for tobacco harm reduction, not as a therapeutic product. Now there is that option of products going to the TGA and going through all that whole pathway, but for lots of reasons, I don't think that's the right way to go.
So that's
Yeah.
great. Thank you, Colin.
Thank you.